Adjunct Professor Kylie Ward, Chief Executive Officer of the Australian College of Nursing. We are the leader of the nursing profession in Australia. We are a member-based organisation representing over 150,000 nurses all around the country, and as well as an education provider, a college in our own right.
And hello, I'm Amanda Cattermole, Chief Executive Officer of the Australian Digital Health Agency. Our agency brings the best of digital innovation to support Australian healthcare consumers with connected care and to support the healthcare providers who care for them.
The members of the Australian College of Nursing keep us very informed through the Faculty of Nursing Informatics as well as through the Chief Nursing Informatics Officer faculty. And what we're hearing is that point of care solutions are one part of the digital equation around interoperability, where nurses can be supported with a good digital framework. They're able to provide more care to the patients, the residents and the clients that they see. And at the end of the day, nobody signs up to do nursing to sit behind a desk or at a computer. It is all about the interaction with people, and the more that the digital platforms can assist nurses to spend time educating, supporting, monitoring and investing in the people that they serve, the more enabled and empowered they are to do their job.
Like you, I am witnessing change, and as a modern leader in this unprecedented time, I believe it is our responsibility to keep busting open out-of-date leadership practices and create this new leadership paradigm, leveraging our learnings of the last few years and heralding a new way of leading our people to solve the complex, deeply interconnected challenges that we face as a nation in healthcare, for our workforce, many of whom you steward, in digital innovation, which my agency stewards, and in the socio-economic climate in which we are all situated.
Like everywhere, of course, we've seen significant shifts in the way that we have needed to provide support to nurses as they've gone about their work in this unbelievably challenging time. And nurses have been great early adopters of digital tools and technologies, and we've seen the uptake really be driven further and further during COVID. And for example, when it's not only telehealth but also the support tools that have helped bring telehealth to life, a good example might be where you've got a nurse with a patient in a remote setting being able to telehealth into a specialist in an urban area and then have that connection and provide that extra care and support. And nurses have really been amazing adopters of getting those tools to work for them as they've had to really change their own practice and face unprecedented challenges while they've been working to support particularly patients in COVID, but also right across the health system over the last 2.5 years.
One of the most profound things I'll say for the nursing profession is that we cannot be automated. In a world of artificial intelligence where you've got probably 10,000 diagnoses, tens of thousands of signs and symptoms, what a nurse does and how different their day is every day, everywhere, is not something that can be automated, and it relies on incredible intuition combined with intellect and the heart. And that is why we are the most respected, ethical and trusted profession in the country and have been for decades. It's why everybody connects with the nurse, trusts a nurse and shares their vulnerabilities and their stories with the nursing profession. And so for me, the most important thing is what can we do to support every nurse everywhere to do their job properly and be supported by data and systems, because we cannot predict who is going to ask a nurse what in their day and what a nurse will come up with in terms of looking after complex care, comorbidities, primary and preventative health.
One of the key roles of the Australian Digital Health Agency is to provide information to support clinicians, nurses, doctors, specialists right across the system to be able to use digital health tools effectively and to improve their own digital health literacy. We do that by offering webinars, face-to-face meetings, we provide education supports and tools, and we work with all of the colleges and peaks and organisations right across the sector to give them the information to then work with the workforces who they provide support support for and leadership too. And through COVID-19, we've developed lots of additional materials that were really designed to support nurses and other parts of the healthcare sector to have those digital tools at their fingertips and to feel really confident about using them at a time when it's absolutely been needed so deeply.
Because nurses work every day, everywhere, every shift, one of the real challenges is in the training and professional development because we are working on a 24/7 roster. We're working in the aged care, primary care, the private, the public, and really any interface, maybe even in shopping centres where care is. So the importance of training and getting access to top training becomes very important. And in some instances, it is embedded within the facilities, and we've got clinical champions that are very important. And nurses are often early adopters, and nurses are renowned for workarounds, so they'll also have the solutions. So for us, if any architecture or any information systems are being developed that include nursing in the construction and design and a co-design model, then we're going to be far more effective. But the collegiality of nurses helping each other and all of the clinicians and all of the members of the team becomes very important. There's always an early adopter, there's always somebody who will champion and then train others in the system.
And I think what's so exciting, Kylie, about where we're up to on this sort of digital enablement of our fabulous workforces like our nursing workforce is it's the combination of exactly what you've described, that on the job, in the moment, with also these growing frameworks that are going to really provide a more structured way of being able to move forward, given how important digital enabling technologies are going to be in the future to support nurses to do their jobs in the absolute best way possible, have the tools they need. And for example, the work that we've been doing recently with the Australasian Institute of Digital Health, which has created a nursing and midwifery national digital health framework. The idea of that is to articulate what are the skills and attributes and capabilities that nurses will need in digital health going forward, so that they can almost have a look at where they're up to and then work out what is it that they need to go and get that capability building, while they also do all the things you're describing on the job, in the moment, and that learning. So it's that sort of structured framework and that local learning that I think is a real game changer for the way we're thinking about digital health enablement in the nursing and midwifery professions.
If you don't have nursing leadership, and if the nursing profession isn't leading the digital platform for our profession, then you're never going to see full adoption. It's that simple. So Chief Nursing Informatics Officers, nursing informaticians, the reality is to be a nurse today, you're a dual professional, whether it's in management, policy, academia, research, education, informatics. Nurses are working with multiple systems and overseeing and coordinating governance and care. And it's vitally important that nursing leadership is at the table.